Question 1. In a training camp some athletes were running on uneven surfaces like bushes, rocks, pits etc. Which type of training were the athletes undergoing? 1. Interval training. 2. Fartlek training. 3. Acceleration run. 4. Ballistic method. Answer: Fartlek training. Question 2. The basic function of management is 1. Controlling. 2. Budgeting. 3. Planning. 4. Organizing. Answer: Planning. Planning is the primary function of management. Planning involves defining the organization's performance objectives and deciding what course of action and resources will be required to accomplish the objectives. Question 3. In which of the following functions of sports event management recruitment process take place? 1. Planning. 2. Staffing. 3. Controlling. 4. Directing. Answer: Staffing. This function involves identifying the necessary staff positions, ensuring the right talent is in place to achieve the event's goals, and includes the processes of recruitment and selection of qualified employees. Question 4. Which committee is responsible for liaison with print media? 1. Technical. 2. Logistics. 3. Marketing. 4. Finance. Answer: Marketing Committee. Question 5. Purchase of sports equipment is a work of the which committee? 1. Technical. 2. Logistics. 3. Marketing. 4. Finance. Answer: Finance Committee. Question 6. When should the publication of rules and regulations be done? 1. Pre-event. 2. During event. 3. Post-event. 4. Any time during the event. Answer: Pre-event. Question 7. After losing a match, a team will be eliminated from the 1. Knockout tournament. 2. League tournament. 3. Round-robin tournament. 4. None of above. Answer: Knockout tournament. Question 8. Which of the following tournament helps save time? 1. Knockout tournament. 2. League tournament. 3. Combination tournament. 4. Round-robin tournament. Answer: A knockout tournament, also known as an elimination tournament, is the type that helps save time because teams are eliminated after a single loss, reducing the overall number of matches needed to determine a winner. Question 9. National Sports Day is celebrated on 1. August 9th. 2. August 19th. 3. August 28th. 4. August 29th. Answer: August 29th, commemorating the birth anniversary of hockey legend Major Dhyan Chand. Question 10. Which of the races is run to promote brotherhood? 1. Run for fun. 2. Run for a specific cause. 3. Run for unity. 4. Health run. Answer: Run for unity. Question 11. What should be the minimum duration of activity per week, at vigorous intensity in adults above 65 years of age? 1. 75 minutes. 2. 150 minutes. 3. 300 minutes. 4. 450 minutes. Answer: 75 minutes. For adults aged 65 and above, the minimum recommended duration of physical activity per week is 75 minutes of vigorous intensity aerobic activity or 150 minutes of moderate intensity aerobic activity or an equivalent combination. Question 12. Rate at which the activity is being performed is known as 1. Volume. 2. Intensity. 3. Type of activity. 4. Frequency. Answer: Intensity. Question 13a. Deformity of the legs is known as 1. Scoliosis. 2. Lordosis. 3. Knock knees. 4. Kyphosis. Answer: Knock knees. Question 13b. Deformity of the legs where the legs curve outwards at the knees, is known as 1. Scoliosis. 2. Bow legs. 3. Knock knees. 4. Kyphosis. Answer: Bow legs. Question 13c. Deformity of the legs where the legs curve inwards at the knees, is known as 1. Scoliosis. 2. Bow legs. 3. Knock knees. 4. Kyphosis. Answer: Knock knees. Question 14. Lordosis is a problem of the 1. Lower back. 2. Middle back. 3. Upper back. 4. Shoulders. Answer: Lower back. Lordosis is a problem of the spine, specifically an exaggerated inward curve, often in the lower back. Question 15. Scoliosis is a postural deformity related to 1. Muscles. 2. Shoulders. 3. Legs. 4. Spine. Answer: Spine, specifically an abnormal lateral, sideways, curvature. Question 16. Kyphosis is a deformity found in 1. Shoulders. 2. Lumbar region. 3. Hips. 4. Thoracic region. Answer: Thoracic region. Kyphosis, a postural deformity, is found in the thoracic region, upper back. Question 17. Sports is an important tool for social empowerment for women as it develops the following. 1 aggression. 2 isolation. 3 stress. 4 leadership. Answer, leadership. Question 18. Psychological benefits of women participation in sports includes 1 improved emotional control. 2 stress reduction. 3 increased self-esteem, and enhanced confidence. 4 all of the above. Answer, all of the above. Question 19. Frequent menstruation is known as 1 metrorrhagia. 2 oligomenorrhea. 3 polymenorrhea. 4 menorrhagia. Answer, menorrhagia. All of women's problems start with men. Mental illness, menstrual cramps, mental breakdown, menopause, gynecologist, and hysterectomy. Question 20. If the menstruation cycle does not begin at puberty, the condition is called 1 primary amenorrhea. 2 secondary amenorrhea. 3 oligomenorrhea. 4 dysmenorrhea. Answer, primary amenorrhea. Question 21. Physical education ensures development of an individual's 1 character. 2 ethnic. 3 skill. 4 overall. Answer, overall. Physical education ensures overall development of an individual. Question 22. Weakening of bones due to loss of bone density and improper bone formation is 1 amenorrhea. 2 anorexia nervosa. 3 osteoporosis. 4 lordosis. Answer, osteoporosis. Question 23. What is the cause of osteoporosis in women? 1 high blood pressure. 2 menarche. 3 excessive exercise. 4 lack of calcium and vitamin D. Answer, lack of calcium and vitamin D. Osteoporosis, a condition causing weakened bones, is primarily caused by a combination of factors including low calcium and vitamin D intake, hormonal imbalances, especially estrogen deficiency in women, and a lack of physical activity. Question 24. Female athlete triad is a syndrome characterized by 1 osteoporosis. 2 amenorrhea. 3 eating disorder. 4 all of the above. Answer, all of the above. Female athlete triad is characterized by osteoporosis, amenorrhea, and eating disorders. Question 25. In which type of anorexia does an individual lose weight by taking laxatives or diuretics? 1 bulimia nervosa. 2 purging type. 3 restricting type. 4 anorexia nervosa. Answer, purging type. Binge purge anorexia. With this subtype, the person greatly restricts the amount and type of food they consume. But they also have binge eating and purging episodes. They may eat large amounts of food in a short time and then intentionally vomit or use laxatives or diuretics to get rid of what they consumed. Question 26. What causes obesity? 1 non-activity. 2 smoking. 3 overindulgence in food. 4 all of the above. Answer, all of the above. Question 27. Ustrasana pose refers to 1 camel pose. 2 cow pose. 3 fish pose. 4 cobra pose. Answer, camel pose. Question 28. Which asana is of side twist pose? 1 Shavasana. 2 Chakrasana. 3 Ardhamasandrasana. 4 Parvatasana. Answer, Ardhamasandrasana. Question 29. Which motor skill is involved in smashing volleyball? 1 cross motor skills. 2 fine motor skills. 3 gross motor skills. 4 open skills. Answer, gross motor skills. Smashing or spiking in volleyball relies heavily on gross motor skills, specifically involving explosive power, coordination, balance, and timing, with the overhead arm swing being the primary motor skill. Question 30. Identify the career in the field of physical education, shown below. 1 sports journalism. 2 sports commentator. 3 sports psychologist. 4 sports manager. Answer, sports commentator. Sports commentator provides live commentary on sporting events. Question 31. Which of the following is not a demerit of league tournament? 1 chances of injury due to fatigue. 2 expensive. 3 fair opportunity. 4 time consuming. Answer, fair opportunity. Question 32. Katakakrasana is a 1 standing asana. 2 sitting asana. 3 lying asana. 4 balancing asana. Answer, standing asana. Kati Chakrasana, meaning waist rotating pose or standing spinal twist, is a yoga asana that involves gently twisting the torso while standing, improving spinal flexibility, digestion, and overall posture. Question 33. Bhujangasana is also known as 1 dog posture. 2 child posture. 3 cobra posture. 4 reverse boat posture. Answer, cobra posture. Question 34. Which asana can be suggested as preparatory asana for Pawan Muktasana? 1 Vajrasana. 2 Bhujangasana. 3 Matsyendrasana. 4 Nakasana. Answer, Matsyendrasana. 4 Pawanmuttasana, wind relieving pose, Ardha Pawanmuttasana, half wind relieving pose, and Supta Matsyendrasana, supine spinal twist pose, can be suggested as preparatory asanas. Question 35. What causes an asthma attack? 1 Allergy. 2 Smoke. 3 Exercise. 4 All of the above. Answer, all of the above. Question 36. Poor exchange of oxygen and carbon dioxide in an individual is the result of 1 Exercise-induced asthma. 2 Allergy-induced asthma. 3 Pulmonary hypertension. 4 Respiratory failure. Answer, respiratory failure. Question 37. Which asana is base asana for curing asthma? 1 Sukhasana. 2 Chakrasana. 3 Matsyasana. 4 Parvatasana. Answer. Sukhasana, also known as the easy pose or the pose of comfort, is a fundamental seated yoga posture that involves crossing the legs and sitting with a straight spine, promoting relaxation, stability, and mindful breathing. Question 38. Which of the asana is for relaxation? 1 Makarasana. 2 Bhadrasana. 3 Archakrasana. 4 All of the above. Answer, all of the above. Makarasana, crocodile pose, Bhadrasana, butterfly pose, and Ardha Chakrasana, half-wheel pose, can be used for relaxation, offering physical and mental benefits. Question 39. Which test is developed to test fitness in senior citizens? 1 Harvard Step. 2 Rickley and Jones. 3 Upper. 4 Rockport. Answer. 2. Rickley and Jones. Question 40. Which asana is base asana is not having back bend? 1 Tadasana. 2 Chakra asana. 3 Bhujangasana. 4 Ushtrasana. Answer, Tadasana, mountain pose. Question 41. The International Paralympics Committee was founded in the year 1 1960. 2 1948. 3 1900. 4 1989. Answer, 1989. Question 42. The reason Paralympic Games got their name was because 1 They were meant for athletes suffering from paraplegia. 2 They run alongside or parallel to the Olympic Games. 3 The athletes are paragons of their sports. 4 They are attended by a large number of paramedics. Answer, they run alongside or parallel to the Olympic Games. Question 43. Paralympic Games was a 1948 sporting competition held at Stoke Mandeville Hospital in 1 England. 2 United States of America. 3 Germany. 4 Greece. Answer, England. Question 44. The founder of Special Olympics was 1 Eunice Kennedy Shriver. 2 John F. Kennedy. 3 Lyndon Johnson. 4 Donald Trump. Answer, Eunice Kennedy Shriver. Question 45. The first Deaflympics Games were held in the year 1 1924. 2 1948. 3 1954. 4 1988. Answer, 1924. The first Deaflympics Games, originally known as the International Silent Games, were held in Paris in 1924. Question 46. Grouping process associated with Paralympics is referred as 1 Divisioning. 2 Classification. 3 Grouping. 4 Categorization. Answer, Classification. Question 47. Grouping process associated with Special Olympics is referred as 1 Divisioning. 2 Classification. 3 Grouping. 4 Categorization. Answer, Divisioning. Question 48. Graded activities as strategy for effective inclusive physical education program includes 1 Complex to simple activities. 2 Simple to complex activities. 3 Challenging abilities. 4 None of the above. Answer, simple to complex activities. Question 49. Which is the first step used in classification for Paralympics? 1 Medical assessment. 2 Functional assessment. 3 Observation. 4 Competition. Answer, medical assessment. Question 50. Inclusion is vast concept that implies 1 Including learners with differing abilities, appearance, and economic conditions in education. 2 Including learners with an emotional or intellectual impairment in mainstream education. 3 Integrating all children with intellectual disabilities into mainstream schooling. 4 Integrating all children with physical disabilities into mainstream schooling. Answer, including learners with differing abilities, appearance, and economic conditions in education. Question 51. Right to Education provides free education for all children within the age group of 1 5-10 years. 2 6-14 years. 3 10-18 years. 4 2-7 years. Answer, 6-14 years. Question 52. Simple fracture is also known as 1 compound fracture, 2 closed fracture, 3 spiral fracture, 4 transverse fracture. Answer, closed fracture. Question 53. Development of gross motor and fine motor skills are benefits which are part of 1 physical benefits, 2 mental benefits, 3 social benefits, 4 emotional benefits. Answer, physical benefits. Question 54. The main cause for night blindness is 1 deficiency of vitamin C, 2 deficiency of vitamin E, 3 deficiency of vitamin A, 4 deficiency of vitamin D. Answer, deficiency of vitamin A. Question 55. Which of the following is least preferred strategy for making physical activities accessible? 1 appropriate space, 2 age-appropriate equipment, 3 trained coaches and scientific resources, 4 exclusive training venue for specific disability sports, 5 common venue with accessibility for multiple disability sports. Answer, exclusive training venue for specific disability sports. The least preferred strategy for making physical activities accessible is exclusive training venue for specific disability sports, as it promotes segregation and doesn't foster inclusivity. Question 56. In which of the following food groups sugar and jaggery come under? 1 protective or regulatory foods, 2 energy-giving foods, 3 bodybuilding foods, 4 immunity boosters foods. Answer, energy-giving foods. Question 57. Dash is the rapid spread of an infectious disease to many people in a given population within a short period of time. Answer, epidemic is the rapid spread of an infectious disease to many people in a given population within a short period of time. Question 58. Which is not a micronutrient? 1 macro minerals, 2 trace minerals, 3 vitamins, 4 protein. Answer, protein. Vitamins and minerals are considered micronutrients because the body needs them in smaller amounts. Proteins, carbohydrates, and fats are macronutrients, which the body requires in larger quantities. Question 59. Which of the following is a water-soluble vitamin? 1 vitamin A, 2 vitamin B, 3 vitamin D, 4 vitamin K. Answer, vitamin B. Vitamins A, D, and K are fat-soluble. Question 60. Iron is a part of 1 trace minerals, 2 macro minerals, 3 vitamins, 4 carbohydrate. Answer, trace minerals. Meaning it's needed in very small amounts for various bodily functions. Question 61. Fats and oils come under 1 protective or regulatory foods, 2 energy-giving foods, 3 bodybuilding group, 4 routine foods. Answer, energy-giving foods. They are also a type of macronutrient, along with carbohydrates and proteins. Question 62. 1 gram of fat provides 1 3 kilocalories, 2 4 kilocalories, 3 5 kilocalories, 4 9 kilocalories. Answer, 9 kilocalories. 1 gram of fat provides approximately 9 kilocalories of energy, making it an energy-giving food. Question 63. Anthocyanins give color to 1 roots, 2 coffee, 3 wheat, 4 grapes. Answer, grapes. Anthocyanins are water-soluble pigments that color the fruit and flowers of many plants. Question 64. Oxalates are present in 1 green leafy vegetables, 2 bajra, 3 nuts, 4 spices. Answer, green leafy vegetables. Question 65. What is an ideal weight to be reduced in 1 week? 250 grams to 500 grams, 500 grams to 1 kilogram, 1 kilogram to 1.5 kilograms, 1.5 kilograms to 2 kilograms. Answer, 500 grams to 1 kilogram. Question 66. BMI between 25 to 29.9 is what? 1 underweight, 2 normal, 3 overweight, 4 obese. Answer, overweight. Question 67. Range of protein intake is 1 5 grams per kilo of body weight to 1 grams per kilo body weight, 2 1 grams per kilo of body weight to 2 grams per kilo body weight, 3 2 grams per kilo of body weight to 3 grams per kilo body weight, 4 3 grams per kilo of body weight to 4 grams per kilo body weight. Answer, 1 gram per kilo of body weight to 2 grams per kilo body weight. The general recommendation for protein intake for adults is around 0.8 grams per kg body weight. Question 68. Approximately, how much carbohydrate is required for strength-dominant sports? 140%, 255%, 370%, 480%. Answer, 55%. Question 69. 50-meter dash is conducted to test 1 strength, 2 acceleration, 3 flexibility. 4 endurance. Answer, acceleration. Question 70. Which test can be applied to test endurance? 1 sit and reach. 2 push UPS. 3 600-meter run/walk. 4 plate tapping test. Answer, 600-meter run/walk. Question 71. Partial curl up is to test what? 1 agility and speed. 2 leg strength and endurance. 3 abdominal strength and endurance. 4 upper body strength and endurance. Answer, abdominal strength and endurance. Question 72. Sit and reach test measures. 1 endurance. 2 flexibility. 3 strength. 4 speed. Answer, flexibility. Question 73. The test duration for the Harvard Fitness Test is 1 3 minutes. 2 4 minutes. 3 5 minutes. 4 6 minutes. Answer, 5 minutes. 5 minutes or until exhaustion, whichever comes first. Question 74. The Harvard Step Test is developed by 1 Harvard. 2 Bruha. 3 Cancel. 4 Psi. Answer, Bruha. The Harvard Step Test, a method to assess cardiovascular fitness, was developed by Lucien Bruha and his associates in 1942. Question 75a. What is BMI? 1 Bodily Mass Index. 2 Body Mass Index. 3 Body Mass Index. 4 Bodily Mass Index. Answer, Body Mass Index. Question 75b. What is BMR? 1 Body Mass of Runner. 2 Batch Manufacturing Record. 3 Basal Metabolic Rate. 4 Base Metal Report. Answer, Basal Metabolic Rate. BMR stands for Basal Metabolic Rate, which is the amount of energy your body needs to maintain basic life functions at rest. Question 76. Which parameter is not required to assess the BMR? 1 Weight. 2 Height. 3 Age. 4 Name. Answer, Name. Question 77. What is a stretch or tear in ligament is known as? Answer, Sprain. Question 78. What is the weight of dumbbell for men in arm curl of Rickley and Jones test? 1 5 pounds. 2 6 pounds. 3 8 pounds. 4 10 pounds. Answer, 8 pounds. Question 79. Johnson, methane test battery has how many items? 1 6. 2 5. 3 4. 4 10. Answer, 4. Question 80. Johnson methane test battery does not consist of which motor stunts? 1 front roll. 2 back roll. 3 side roll. 4 jumping full turns. Answer, side roll. Question 81. Which system provide energy during a 5,000 meter race? 1 ATP CP system. 2 anaerobic system. 3 aerobic system. 4 endurance system. Answer, aerobic system. Question 82. Slow twist fibers are of which color? 1 red. 2 white. 3 black. 4 blue. Answer, red. Question 83. VO2 max is related to what? 1 muscular system. 2 respiratory system. 3 cardiovascular system. 4 energy production system. Answer, cardiovascular system. Question 84. Which is not a property of muscles? 1 contractility. 2 excitability. 3 extensibility. 4 durability. Answer, durability. Question 85. Which is not a long-term effects of exercise on muscular system? 1 hypertrophy of muscle. 2 increased metabolism. 3 increased myoglobin. 4 increased blood supply. Answer, increased blood supply. Question 86. Which is not a short-term effects of exercise on muscular system? 1 accumulation of lactate. 2 microtears in muscle fibers. 3 increase muscle temperature. 4 increase in lactate acid tolerance. Answer, increase in lactate acid tolerance. Question 87. Physical activity helps to increase what? 1 size of muscle. 2 size of bone. 3 size of brain. 4 size of liver. Answer, size of muscle. Question 88. Increase in glycogen stored in muscle is an effect of 1 aerobic training. 2 anaerobic training. 3 cross training. 4 all of the above. Answer, all of the above. Question 89. The resting cardiac output is approximately 10 liters. 1 liter. 5 liters. 15 liters. Answer, 5 liters. The resting cardiac output, the amount of blood pumped by the heart per minute, is approximately 5 liters per minute. Question 90. The volume of blood pumped during 1 beat, contraction, is called 1 blood flow. 2 stroke volume. 3 veins and arteries. 4 capillaries. Answer, stroke volume. Question 91. Cardiac hypertrophy is 1. Plateauing of heart rate due to maximal exercise intensity. 2. Enlargement of heart due to chronic endurance training. 3. Lowering of heart rate due to physical training. 4. Increase in ventricular volume because of exercise. Answer, enlargement of heart due to chronic endurance training. Question 92. The amount of breath per minute increases during exercise to 20 breath per minute, 40 breath per minute, 30 breath per minute, 10 breath per minute. Answer, 40 breath per minute. At rest, a normal breathing rate is around 15 to 20 breaths per minute. Question 93. Men and women usually attain their highest strength levels between the ages of 1 and 2 years, 5 and 7 years, 7 and 11 years, 20 and 40 years. Answer, 20 and 40 years. Question 94. It is a measure of the amount of minerals, mostly calcium and phosphorus, contained in a certain volume of bone. 1. Body composition. 2. Bone mass. 3. Pulmonary function. 4. Neural function. Answer, bone mass. Question 95. The chemical substances synthesized by specific host glands, secreted into the blood, and carried throughout the body are called 1. Hormones. 2. Sugar. 3. Electrolytes. 4. Capillaries. Answer, hormones. Question 96. It is a disease in which bone weakening increases the risk of a broken bone. 1. Measles. 2. Osteoporosis. 3. Atherosclerosis. 4. Beriberi. Answer, osteoporosis. Question 97. Decrease in size of a body part, cell, organ, or other tissue is called 1. Myopia. 2. Atrophy. 3. Cardiac arrest. 4. Cardiac cycle. Answer, atrophy. Question 98. A sprain is an injury to 1. Muscle. 2. Tendon. 3. Ligament. 4. Bone. Answer, ligament. Question 99. A fracture is an example of injury to 1. Skin. 2. Soft tissue. 3. Hard tissue. 4. Eyes. Answer, hard tissue. Question 100. A soft tissue injury damages 1. Ligaments and tendons. 2. Bone. 3. Cartilage and muscles. 4. Carpals. Answer, ligaments and tendons. Question 101. A fracture in which the bone breaks diagonally is called a dash fracture. 1. Green stick. 2. Impacted. 3. Oblique. 4. Transverse. Answer, oblique. Question 102. According to Newton's second law of motion, the greater the movement of an object, 1. The longer distance will it travel. 2. Stronger will it resist the external forces. 3. Speedier it will cover the given distance. 4. More stable will it remain in its motion. Answer, more stable will it remain in its motion. Question 103. Newton's first law of motion is known as the 1. Law of reaction. 2. Law of inertia. 3. Law of effect. 4. Law of momentum. Answer, law of inertia. Question 104. Isotonic exercise helps in enhancing 1. Strength. 2. Speed. 3. Agility. 4. Endurance. Answer, strength. Question 105. Acceleration due to an external force acting on a moving object is technically defined as the change in that object's 1. Location. 2. Direction. 3. Velocity. 4. Movement. Answer, velocity. Question 106. The 3 basic components of a lever are 1. Mass, weight and velocity. 2. Force, fulcrum and load. 3. Fulcrum, resistance and effort. 4. Both B and C. Answer, force, fulcrum and load. Fulcrum equals pivot point of the lever. Load equals object, resistance is another term for load. Effort equals force applied to the lever. Question 107. Push-up is an example of which lever? 1. Law of reaction. 2. Law of inertia. 3. Resultant force. 4. Law of effect. Answer, law of reaction. Question 108. In the human body, the most common class of lever. 1. First-class lever. 2. Second-class lever. 3. Third-class lever. 4. None of the above. Answer, third-class lever. Third-class levers are the most common in the human body. Here, the force is applied between the load and the fulcrum. A broom is a good example of a third-class lever where the hand on top of the broom represents the fulcrum, or the pivot point. Question 109. When the sum of force acting upon the object and sum of the movement acting upon the body is both equal to 0, then the body is said to be in 1. Equilibrium. 2. Static equilibrium. 3. Dynamic equilibrium. 4. Zero force. Answer, Equilibrium. When the sum of force and sum of the movement are zero, then the body is said to be in equilibrium. Question 110. The position of the center of gravity changes depending upon the 1. Position of force. 2. Position of the body. 3. Position of the intersection of force. 4. Position of stability. Answer: position of the body. Question 111. Center of gravity is the average location of an object's 1. Weight. 2. Force. 3. Balance. 4. Velocity. Answer: weight. Question 112. The friction force acts in what direction to the direction of motion of an object? 1. Opposite. 2. Same. 3. Downwards. 4. Diagonal. Answer: opposite. Question 113. Among the following sports, in which does friction plays the least important role? 1. Car race. 2. Football. 3. Hockey. 4. Ice skating. Answer: ice skating. Question 114. Friction is a 1. Magnetic force. 2. Non-contact force. 3. Contact force. 4. Couple force. Answer: contact force. Question 115. Cyclist often wears streamlined helmets and specially designed clothing to reduce calibration. 1. Fluid friction. 2. Rolling friction. 3. Sliding friction. 4. None of the above. Answer: fluid friction. Question 116. Factors that bring air resistance into play. 1. Larger the surface area. 2. Rough surface. 3. Smaller the mass. 4. All of the above. Answer: all of the above. Question 117. The motion of a projectile is due to two separate simultaneously occurring components of motion, and they are 1. One along the vertical. 2. One along the horizontal. 3. Both 1 and 2. 4. None of above. Answer: both 1 and 2. 1 along the vertical and 1 along the horizontal. Question 118. According to Professor John Fontanella, the ideal angles from the free throw line will vary from what to what with shorter players? 1. 48.7 degrees to 52.2 degrees. 2. 45.6 degrees and 50.2 degrees. 3. No specific degree. 4. Any degree. Answer: 48.7 degrees to 52.2 degrees. Question 119. Personality is derived from a Latin word persona meaning 1. Shape. 2. Mask. 3. Stage. 4. Philosophy. Answer: mask. Question 120. Which can be a suitable concept related to personality in sports? 1. Stable but not unique characteristics. 2. Stable and unique characteristics. 3. Unstable characteristics. 4. Dynamic behavior pattern. Answer: stable and unique characteristics. Question 121. A person who is bold and outgoing is an 1. Introvert. 2. Extrovert. 3. Ambivert. 4. Somatotype. Answer: extrovert. An extrovert is someone who is bold, outgoing, and energized by social interactions. Extroverts tend to thrive in group settings and are often seen as talkative and enthusiastic. Question 122. Motivation that drives individuals to naturally pursue actions that provide fun, joy, pleasure, or challenge is called 1. Extrinsic motivation. 2. Motivation. 3. Intrinsic motivation. 4. Cognitive motivation. Answer: intrinsic motivation. Question 123. Motivation through reward or praise is known as 1. Intrinsic motivation. 2. Extrinsic motivation. 3. Pedagogical motivation. 4. Facilitation motivation. Answer: extrinsic motivation. Extrinsic motivation is driven by external factors, such as rewards, praise, recognition, or avoiding negative outcomes. These incentives encourage individuals to perform tasks even if the activity itself isn't inherently enjoyable. Question 124. Which of the following is not a feature of intrinsic motivation? 1. Goals. 2. Feedback. 3. Needs. 4. Attitudes. Answer: feedback. Intrinsic motivation is primarily driven by internal factors like goals, needs, and attitudes, things that give personal satisfaction or fulfillment. While feedback can play a role, it is typically associated more with external reinforcement, which aligns with extrinsic motivation rather than intrinsic motivation. Question 125. Which of the following is effective for prevention of coronary heart disease? 1. Regular exercise. 2. Sedentary lifestyle. 3. Medicine. 4. Dieting. Answer: regular exercise. Question 126. Which one of the following is not a result of regular exercise? 1. Increased bone density. 2. Increased cholesterol level. 3. Strong immune system. 4. Increased longevity. Answer: increased cholesterol level. Question 127. Who discovered vitamin A? 1. Dr. MC Column. 2. Dr. Harvard. 3. Dr. J.B. Nash. 4. Dr. Coubertin. Answer. Dr. MC Column. Question 128. Which of the following is a legitimate behavior? 1. Hostile aggression. 2. Instrumental aggression. 3. Assertiveness. 4. Proactive aggression. Answer. Assertiveness. Assertiveness is a legitimate behavior as it involves expressing one's needs, opinions, or rights in a respectful and confident manner without infringing on others. Question 129. In instrumental aggression, the main aim to using aggression is 1. Cause harm to the opponent. 2. Achieve a positive goal. 3. Express your feeling of jealousy. 4. Show your hostility to an opponent. Answer. Achieve a positive goal. Instrumental aggression is goal-oriented and used as a means to an end. The aggression is not driven by anger or hostility but is instead deliberate and calculated to achieve a specific outcome, such as winning a competition or gaining a reward. Question 130. Aggression is displayed in sports through 1. Assertion of views. 2. Use of abusive words. 3. Walking away from the opponent. 4. Strictly following the rules. Answer. Assertion of views. In sports, aggression is often displayed through assertive actions, which involve confidently expressing one's views or competing with determination while staying within the boundaries of sportsmanship. This form of aggression is controlled and purposeful, aimed at achieving goals rather than causing harm or breaking rules. Question 131. Hal asana is used for curing which of the following deformities? 1. Kyphosis. 2. Scoliosis. 3. Lordosis. 4. Flatfoot. Answer. Lordosis. Question 132. Which type of goal focus on final result of an event? 1. Outcome goal. 2. Process goal. 3. Product goal. 4. Goal post. Answer. Outcome goal. An outcome goal focuses on the final result or achievement of an event, such as winning a competition or securing a specific ranking. It emphasizes the end result rather than the steps or processes involved. Question 133. Process of recreating images in mind to improve performance in sports is referred as 1. Self-talk. 2. Self-esteem. 3. Goal setting. 4. Mental imagery. Answer. Mental imagery. Question 134. Which trait best reflected the personality of junior players? 1. Introvert. 2. Conscientiousness. 3. Neuroticism. 4. Extrovert. Answer. Conscientiousness. This trait encompasses being responsible, organized, and diligent, which are valuable qualities for junior players who need to follow instructions, practice consistently, and work towards team goals. Question 135. Which member of the team reflected most of the extrovert traits? 1. Coach. 2. New members. 3. Captain. 4. Goalkeeper. Answer. Captain. The captain of a team often reflects extrovert traits, such as being outgoing, confident, and communicative. These qualities help them lead the team effectively, motivate their teammates, and maintain strong relationships on and off the field. Question 136. Which type of players were recommended for special training with sports psychologist? 1. Extrovert. 2. Introvert. 3. Mesomorph. 4. Injured. Answer. Injured. Sports psychologists often play a crucial role in helping athletes cope with the psychological challenges associated with injuries and rehabilitation. Question 137. The team sports psychologist is referring to which type of behavior as non-threatening but confident? 1. Assertive. 2. Hostile. 3. Instrumental. 4. Calm. Answer. Assertive. Question 138. The performance enhancement in the future can be predicted based on 1. Physiological factor. 2. Physical factor. 3. Talent indicators. 4. All of the above. Answer. All of the above. Question 139. Psychological factors contributing to talent identification is 1. Cognitive. 2. Emotional. 3. Personality traits. 4. All of the above. Answer. All of the above. Question 140. Talent identification is what process? 1. General process. 2. Scientific process. 3. Specific process. 4. None of the above. Answer. Scientific process. Question 141. Mesocycle is training of 1. 1 week. 2. 4 to 10 days. 3. 3 to 6 weeks. 4. 3 3 months. Answer. 3 to 6 weeks. Question 142. Transitional phase is a 1. Rest and recovery period. 2. Training period. 3. Competition period. 4. Fitness period. Answer. Rest and recovery period. The transitional phase occurs after the competition season. It is a time for athletes to rest, recover, and rejuvenate both physically and mentally. This phase helps prevent burnout, allows healing of injuries, and prepares the body for the next training cycle. Question 143. Microcycle is 3 to 10 weeks, 3 to 10 days, 3 to 10 hours. None from above. Answer: 3 to 10 days. A microcycle is a short training cycle that typically lasts between 3 to 10 days. It is a part of a larger training structure and focuses on specific objectives, such as skill development, endurance, or recovery, depending on the athlete's needs. A microcycle is the shortest training cycle in periodization. Periodization is the systematic planning of athletic or physical training. A mesocycle typically lasts 2-6 weeks. A macrocycle typically lasts a year or more. Question 144. The isokinetic method was developed by 1. H.C. Buck, 2. Joy Perny, 3. J.J. Perrine, 4. J.J. Coubertin. Answer: J.J. Perrine. Question 145. An exercise in which movement is visible. 1. Isometric, 2. Isotonic, 3. Isokinetic, 4. Isonomic. Answer: Isotonic exercises involve visible movement of a joint. Question 146. Under which kind of strength would you put shot put? 1. Strength endurance, 2. Explosive strength, 3. Maximum strength, 4. Speed strength. Answer: Explosive strength. Question 147. Which is not a type of endurance according to the nature of activities? 1. Basic endurance, 2. General endurance, 3. Specific endurance, 4. Speed endurance. Answer: General endurance. Question 148. 400m sprint event comes under 1. Speed endurance, 2. Short endurance, 3. Medium endurance, 4. Long endurance. Answer: Speed endurance. Question 149. There will be no variation in the pace of inactivity in 1. Fartlek method, 2. Continuous method, 3. Interval, 4. None of the above. Answer: Continuous method. Question 150. The Swedish word meaning speed play is 1. Fartlek method, 2. Continuous method, 3. Pace method, 4. None of the above. Answer: Fartlek method. The term fartlek is derived from the Swedish words for speed, fart, and play, lek. It refers to a training method that involves varying the intensity and speed during a workout, combining periods of fast running with slower paced recovery. Question 151. Which is not a type of speed? 1. Reaction, 2. Sprinting, 3. Acceleration, 4. Speed endurance. Answer: Sprinting. In the context of physical education, sprinting, option 2, is not a type of speed ability, but rather a specific type of movement that utilizes speed abilities. Question 152. What type of speed is defined as the ability to maintain maximal speed for maximal distance and maximum duration? 1. Acceleration ability, 2. Locomotor ability, 3. Movement ability, 4. Reaction ability. Answer: Locomotor ability. Question 153. Acceleration run and pace run can be two methods of improving. 1. Flexibility, 2. Speed, 3. Endurance, 4. Strength. Answer: Speed. Question 154. Which is not a type of flexibility? 1. Active, 2. Passive, 3. Ballistic, 4. Stretch. Answer: Stretch. Stretch, however, is not categorized as a type of flexibility. It's a general term for the action of extending muscles, while active flexibility, passive flexibility, and ballistic flexibility are types of flexibility. Question 155. In which method is stretching done rhythmically? 1. Slow stretch, 2. Slow stretch and hold, 3. Ballistic method, 4. PNF. Answer: In the ballistic method, stretching is performed rhythmically, using momentum and repetitive bouncing or swinging motions. Question 156. Which of the following factors does not influence flexibility? 1. Structure of joints, 2. Proper warming up, 3. Body temperature, 4. None of these. Answer: None of these. Question 157. What are the necessary steps in improving flexibility? 1. Proper warm-up, 2. Proper stretching, 3. Repetition of, 4. All of these. Answer: All of these. Question 158. Which of the following is not a procedure used in league fixtures? 1. Cyclic method, 2. Stair method, 3. Ladder method, 4. Tabular method. Answer: Ladder method. Question 159. The ability to attain a high level of fine-tuning of movement phases is known as 1. Differentiation ability, 2. Orientation ability, 3. Adaptation ability. 4. Coupling ability. Answer, differentiation ability. Question 160. What kind of coordinate abilities are defined as determining a body's position and its part in time and space concerning gravity and moving objects? 1. Differentiation ability. 2. Orientation ability. 3. Adaptation ability. 4. Coupling ability. Answer, differentiation ability. Differentiation ability refers to the coordinated ability to determine a body's position and its parts in relation to time, space, gravity, and moving objects. This means accurately perceiving where your body is in relation to its surroundings while in motion, which is crucial for precise movements in sports. Question 161. The heart rate in continuous method of training should be about dash beats per minute and duration for the activity should be dash. Answer, the heart rate in continuous method of training should be about 120 to 160 beats per minute and duration for the activity should be 20 minutes. Question 162. Interval training method is based on the principle of what? Answer, interval training method is based on the principle of work and recovery. Question 163. Fartlek is a dash term meaning speed play. Answer, Fartlek is a Swedish term meaning speed play. Question 164. Fartlek was developed by dash in 1930. Answer, Fartlek was developed by Gösta Holmer in 1930. Question 165. Sit-ups are examples of which kind of strength? Answer, sit-ups are examples of dynamic strength, specifically core strength. Sit-ups are examples of abdominal muscular endurance training, focusing on strengthening and toning the abdominal muscles. Question 166. Dash method was developed by J.J. Perrine in 1960. Answer, isokinetic method was developed by J.J. Perrine in 1960. Question 167. Dash exercise has no movement or change in size of muscles. Answer, an isometric exercise has no movement or change in size of muscles. Question 168. A dash is a piece of medical equipment used to prevent an injured body part from moving and to protect it from any further damage. Answer, a splint is a piece of medical equipment used to prevent an injured body part from moving and to protect it from any further damage. Question 169. Given below are two statements marked assertion and reason. Read the two statements carefully and choose the correct option. Assertion, sports training is an unorganized instruction for a planned performance activity. Reason, it trains the players in enduring physical load through a variety of physical exercises backed up by necessary technical and tactical inputs. 1. Both assertion and reason are true and reason is the correct explanation of assertion. 2. Both assertion and reason are true but reason is not the correct explanation of assertion. 3. Assertion is true and reason is false. 4. Assertion is false and reason is true. Answer, assertion is false and reason is true. The assertion sports training is an unorganized instruction for a planned performance activity is false. Sports training is inherently a planned and structured process aimed at improving performance in a specific sport, making the statement inaccurate. Question 170. The ability to coordinate body part movements with one another and about a definite goal-oriented body movement is known as 1. Balance ability. 2. Adaptation ability. 3. Rhythm ability. 4. Coupling ability. Answer, coupling ability. Coupling ability refers to the skill of coordinating different body parts to work together effectively to achieve a specific, goal-oriented movement. Question 171. Which of the following body type is needed for a long jumper? 1. Endomorph. 2. Ectomorph. 3. Mesomorph. 4. All of these. Answer, mesomorph. Mesomorphs are best suited for long jumping as they have a naturally athletic build with a strong muscular structure and low body fat. Question 172. Newton's second law of motion is also known as 1. Law of reaction. 2. Law of inertia. 3. Resultant force. 4. Law of effect. Answer, Newton's second law of motion is also known as the law of force and acceleration or law of momentum. Question 173. Gliding movement occurs at which joint? Hip, knee, wrist, elbow. Answer, wrist. Question 174. Normally people do not adhere to a regular exercising program due to 1. Lack of proper goals. 2. Adding a variety of exercises. 3. Social support enhancement. 4. Feedback from instructor. Answer, lack of proper goals. The absence of clear, achievable goals can make an exercise program feel directionless, reducing motivation and commitment. Question 175. Which postural deformity has convexities right or left? 1. Knock knees. 2. Flat foot. 3. Scoliosis. 4. Kyphosis. Answer, scoliosis. Question 176. Which one of the goals, focus on technique for executing a task? 1. Process goal. 2. Product goal. 3. Outcome goal. 4. Goal post. Answer, Process goal. A process goal focuses on the specific techniques or strategies required to execute a task effectively. Question 177. What is the other name for vitamin B2? 1. Thiamine. 2. Niacin. 3. Folic acid. 4. Riboflavin. Answer. Riboflavin. Riboflavin is a water-soluble vitamin that plays a crucial role in energy production and the metabolism of fats, drugs, and steroids. Question 178. In Ardha Chakrasana, which is the correct pose? 1. Back bend in standing position. 2. Forward bend in standing position. 3. Leg raised in sitting position. 4. Head and lead raised in lying position. Answer. Back bend in standing position. Question 179. What is the test duration for the arm curl test? 2 minutes. 1 minute. 30 seconds. Number of repetitions. Answer. 30 seconds. Question 180. Which gland secretes the hormone insulin, the lack of which is associated with diabetes? 1. Endocrine glands. 2. Pituitary. 3. Pancreas. 4. Hypothalamus. Answer. Pancreas. Question 181. The laws of motion are given by 1. Galileo. 2. Pascal. 3. Newton. 4. None of the above. Answer. Newton. Thank you for watching. Make sure you like this video and share it with your friends and classmates. If you are new here, do subscribe to the channel and press on the bell icon to get notifications of new videos.